Dear students, welcome back. In the previous session, we have seen the muscles actions at the radioulnar joint. Now we are going to see the stability of the radioulnar joints. I have also mentioned the stability of the radioulnar joint at the proximal level. Now we are going to see the stability of the radioulnar joint at the distal radioulnar joint, as well as the stability of the forearm. Now, normally at the distal radioulnar joint, the muscular support is getting from the Pronator Quadratus muscle and the Extensor Carpi ulnaris tendon. So what are the muscles? The Extensor Carpi ulnaris. So this is here you can see in this here, this one is the flexor aspect, but this Extensor Carpi ulnaris we can see on the extensor aspect. So it is originating from the lateral epicondyle and it is getting inserted towards the base of the fifth metacarpal, That tendon is giving stability at the distal radioulnar joint, and also the Pronator Quadratus. So Pronator Quadratus, so which is present on the flexor aspect itself. So from the radius to the ulna, this is a quadrilateral muscle. So these are the two muscles which is giving muscular support, and also the another muscle which is called as the Extensor Carpi Radialis Brevis, which is also provide support for the forearm. Actually, this Extensor Carpi Radialis Brevis is also originating from the common extensor origin, and it is getting inserted to the dorsal aspects of the bases of second and third metacarpal bones. Okay, and this muscle is crossing over the forearm and it is getting inserted. Okay, so this is the common extensor origin, but on the posterior aspect the muscle is getting like this and it is getting inserted. So the course is like this and it is getting inserted to the second and third metacarpal bases of those metacarpals. So these are the three muscles which is giving support to the distal radioulnar joint. So the muscular support of the distal radioulnar joint is getting from the Pronator Quadratus, Extensor Carpi ulnaris and the Extensor Carpi Radialis Brevis. Now we will see how these muscles are giving support and what is the action of these muscles at this level of joints. So the deep head of the Pronator Quadratus. So as we know that, so the Pronator Quadratus is also having two fibers. One is the superficial and the deep. So here the deep heads of the Pronator Quadratus is active throughout supination and pronation, and therefore it is thought to provide dynamic stabilization for the distal radioulnar joint. Okay, and coming to the activity of the Extensor Carpi ulnaris muscle, which exerts a depressive force on the dorsal aspect of the ulnar head. What is the function? So it is acting as a depressive force on the dorsal aspect of the ulnar head as the tendon is stretched over the head during supination. So how this depressive force is getting? So the tendon of Extensor Carpi ulnaris is going to stretch over the head during supination, and the tension in the tendon helps to maintain the position of the ulnar head during both supination and pronation. So this is the function of extensor carpi ulnaris muscle at the level of distal radio-ulnar joints. Now coming to the extensor carpi radialis brevis, which is also provides support for the forearm. So, and it is evidenced by maximum voluntary effort. So it is also having an evidence name called MVE, that is maximum voluntary effort. Now, how much maximum voluntary effort is exhibited by this muscle? So this maximum voluntary effort in the extensor carpi radialis brevis occurs in both supination as well as in pronation torques. In the supination torques, it ranges from 26% to 43% of maximum voluntary effort is exhibited by this muscle. Whereas in the pronation, it is exhibiting 27% to 55% of maximum voluntary effort. The extensor carpi radialis brevis also appears to act both as a stabilizer to the forearm for gripping. So this extensor carpi radialis brevis not only gives support to the distal radio-ulnar joint as well as the forearm, it also helps in gripping. It also helps in gripping during pronation torques depending on the forearm angle. So that means forearm angle, whether it is an varus or on valgus, that thing we should see in considering the stabilization of this muscle during gripping. And it acts as a prime mover for wrist extension for supination torques. So almost all the muscles, the extensors as well as the flexors, which are having minimum effect at the elbow joint and forearm, will have the major functions at the wrist and hand. Although they will have major function at the wrist and hand, some of the functions of this extensor carpi radialis brevis and the extensor carpi ulnaris also helps in the stability of the distal radio-ulnar joint. Now coming to the non-muscular support. So up to here we have seen the muscular support to the distal radio-ulnar joint. Now we will see the non-muscular support of the distal radio-ulnar joints. So now non-muscular, that means what are the other structures? Normally what are the structures which giving support or stability to the joints? One is the capsule and another one is normally the ligaments, and also any tendons crossing over that one we have already seen in the muscular support. The tendon or the direct muscle which are crossing the joints or comes under the muscular support. And the non-muscular support, so we have to consider the structures which provide support or stability to the joint. Here comes the under non-muscular support. It is done by or it is provided by the dorsal radio-ulnar ligament as well as the palmar radio-ulnar ligament, and also very important thing, that is the interosseous membrane. And interosseous membrane and its tract, how it is arranged, how the fibers are arranged, which comes under its tract, and also a very very important thing, that is the articular disc. Another one is the articular disc. Okay, now how the dorsal radio-ulnar ligament and palmar radio-ulnar ligament gives dynamic stabilization to this distal radioulnar joint. The dorsal radioulnar ligament as well as the palmar radioulnar ligament becomes taut in pronation. The dorsal radioulnar ligament especially, which is taut in pronation, whereas the palmar radioulnar ligament becomes taut in supination. During supination, the palmar radioulnar ligament is taut. During pronation, the dorsal radioulnar ligament is taut. Okay, and based on these structures, some studies have been recorded by different investigators. We will see those investigations and those studies one by one. The first one is the Schind. According to Schind, the radioulnar joints will have limited cross-sectional areas. So these structures will have limited cross-sectional areas, and also these structures will have low structural stiffness. But though it is having less cross-sectional area and low structural stiffness, but they are able to prevent, these two structures are able to prevent separation of radius from the ulna. So these are the two structures helps in preventing the separation of radius from ulna. And when this function is going to be happen, it occurs during loading. And also allow for force transmission from radius to ulna. From radius to ulna, the force transmission from radius to ulna through the distal radioulnar joints. Okay, so what is the study? What is the investigation done by the Schind? They found that the dorsal radioulnar ligament and the palmar radioulnar ligament is having limited cross-sectional area and also low structural stiffness, but these two ligaments are able to prevent the separation of radius from ulna when during loading, and also allow for the force transmission from the radius to the ulna through the distal radioulnar joint. Okay, and however these ligaments, so this dorsal and radioulnar ligaments as well as the palmar radioulnar ligaments will not help in a longitudinal stability. This will give only such kind of transverse stability, but longitudinal stability is not provided by these two ligaments. And these ligaments allow approximately 5 millimeters of play between the radius and ulna before providing a resistance to further distraction. So it only allows 5 millimeters of play, that means movement. Okay, now the radioulnar ligaments, the articular disc and the pronator quadratus maintain the ulna within the ulnar notch and preventing the ulna from subluxation and dislocation. And the interosseous membrane provides stability for the distal joint by binding the radius and ulna together. So these are the findings by the investigations of the Schind. Okay, now we will see another studies by Scahan and co-workers. Here they mentioned that the interosseous membrane in the combination with the triangular fibrocartilaginous complex provide important longitudinal stabilization. So in the previous skinned described the transverse stabilization of the distal radioulnar joint, whereas Scahan and co-workers finds that the interosseous membrane along with the fibrocartilaginous articular disc or fibrocartilaginous complex, this is the fibrocartilaginous complex, provide important longitudinal stabilization. Now we will see another studies done by other people called Markov and Associates study radioulnar load sharing. Radioulnar load sharing at the wrist and elbow with the elbow in varus, valgus and neutral position. So they have studied the load sharing under the radioulnar joints at the wrist and elbow with the elbow in varus as well as in valgus conditions and also the neutral positions. When the elbow was in varus position, so how the elbow, normally the varus means, so if you take this is the anatomical position, the elbow is like this. So the elbow, this is the varus position of the elbow. In the varus position, the head of the radius and capitulum are not in contact. Valgus means this is the valgus situation. The elbow is towards the midline, then it is called the valgus condition. Okay, so in this valgus condition, the head of the radius and the capitulum are in contact. Okay, now, so when the elbow was in varus position, no contact between the radial head and the capitulum. In this condition, the force was transmitted from the distal radius through the interosseous membrane and to the proximal ulna when the elbow was in varus. So here you can see this is somewhat in a varus position. So this you can see, so this one is somewhat in varus position. So in this varus position, what will happen? So the force, here you can see the red color, the force is transmitting from the wrist to the distal radioulnar joint through the radius and it is transmitting to the proximal ulna through the interosseous membrane. Okay, and when the elbow is in valgus position, now when the elbow is in valgus position, in that there is a contact between radial head and capitulum is present. Then the force was transmitted through the radius. So that means what will happen? How the force? Now the force, if it is in valgus, so these two are in contact, then the force is directly transmitted like this. There is no sharing or transfer of load to the other bone is happening. When the forearm is in neutral position, the mean force in the distal end of the ulna averaged 7% of the applied wrist load, while the force of the proximal ulna averaged 93% of the load applied to the wrist. So, the mean force in the distal end of the ulna, so that means the distal end of the ulna is only taken by 7% of the applied wrist load when the wrist is at load. So that means some load. So here what is the load? Here the hand is pressing against the ground. So some load is adding here. So what is happening? In the case of ulna, what is happening? The lower end is taking only 7% of the applied wrist load, whereas the proximal ulna at an average of 93% of the load is taken up by this ulna, which is applied at the wrist. The tract associated with the interosseous membrane, that means how from where to where this interosseous membrane is attached throughout the forearm. So the entire tract is taut in pronation and which is loose in supination. During pronation, the tract protects the ulnar head in a sling. It also provides stability for the joint by reinforcing the dorsal aspect of the joint capsule. Okay, so the dorsal aspect of the joint capsule also reinforced by this interosseous membrane tract. Okay, these are the findings which are found by the Markov and associate, and also he also mentioned that the articular disc acts as a cushion in allowing compression force transmission from the carpals to the ulna and acts as a stabilizer of the ulnar side of the carpals. So this articular disc has two functions. One is it is giving some cushioning effect from the compressive force which is transmitted from the carpals to the ulna, and it is also acts as stabilizer for the ulnar side. It also acts as a stabilizer of the ulnar side of the carpals, and also the disc assists in the transmission of compressive forces from the radius to the ulna. So these are the findings by Markov. So we have to consider all these various findings in assessment of any joint dysfunction. So for that reason only we are going to take all the studies and all the evidences which are given by great investigators. Okay, now another investigators called Adams and Holley used a distractive force to stimulate the effects of the separation of articulating surfaces that accompanies a power group. So these people used some distractive force to stimulate. So distractive force means, so they are normally they applied some distractive force like this thing. So some of the distractive forces which can separate this ulna and the radius. Okay, and they have studied, okay, which accompanies during power grip. So during power grip they applied a distractive force to study the effects at this joint. These authors found that strain distribution in the disc was dependent on forearm position. So they have found that the strain distribution in the disc was dependent on forearm position. That means whether it is in supination or in pronation. That is, the tension across the entire disc is decreased during supination and which is increased in the radial portion of the disc in pronation. So the tension in the disc is decreased in supination position. This is the supination. If you see during pronation like this, pronation what will happen? So the tension is increased at the radial portion of the disc in pronation. So finally the authors concluded that articular disc regularly bears both compressive as well as tensile strains. And other studies by Mikey, compressive forces are transmitted through the central portion of the disc, and some of the load is converted to tensile loading within the peripheral margins. So these are the studies done by various investigators. So finally, what we have to take from these studies, how the stability of the radioulnar joints at the distal end of the radioulnar joint is maintained. Okay. With this, we have finished the stability of the radioulnar joints. In the next session, we are going to see the mobility and stability of the entire elbow complex. What is elbow complex? This elbow complex includes both elbow joint as well as the radioulnar joints combined to call as elbow complex. So we have seen individually the elbow complex separately and the radioulnar joints separately. In the next session, we are going to see the mobility and the stability of the elbow complex. That means we are going to mix up with these two joints, how they are related to hand and wrist. Okay. So, thank you.